Welcome back to the Brighton Chamber podcast. I'm your host, Cameron Harris, and today I'm joined by Vikram Gottam from Art of Dermatology and also Mary Mekha. Welcome to the studio.
Thank you. We're excited to be here.
Likewise.
Can you guys tell me what Art of Dermatology is?
So we are a dermatology practice based in Metro Detroit, 10 locations and growing. We specialize in everything related to the hair, skin, nails. We treat patients as little as toddlers, infants, newborns, all the way to teenagers and their acne. We specialize in all skin conditions, including rosacea, eczema, those unsightly warts. You have a cyst you need to get removed.
Body skin exams, all of that.
Right, exactly. So if you have a skin concern, our goal is to get you in our office, and our job is to make sure it gets taken care of properly.
What makes you guys different? Because you kind of see a lot of skincare companies or dermatology companies around. What makes you guys different from them?
Right. So one of the big differences between us and other dermatology practices is, we take a lot of pride in our providers in making sure we have the right staff that are expertly trained so that when you're coming in, you are being treated and evaluated by somebody with years and years of experience. We don't let someone who has seen, let's say, a few cases or has very little experience in the field, coming and treating you. One of the other big advantages, I think, coming to see us is that every decision we make in terms of how we have built our practice is making sure patient care is put at the forefront. So all our decisions are there to make sure, as the patient coming in, you're getting the best possible treatment. And that is something that's changed in medicine over the last 2 decades. And we've been trying very hard to make sure, at least at our dermatology, we maintain that kind of standard of excellence.
Nowadays, when you go to a medical practice or you go to a dermatology practice, the provider comes in the room for about 5 minutes, has to do what they do, and doesn't take their time with you, doesn't address your concerns, kind of just rushes the visit. The patient leaves feeling so just not satisfied with what's going on. And that's because, all those practices are owned by private equity and they're owned by banks, and they're telling the providers, you have to see more patients and you can't spend too much time in the room. So that's what makes us different. We don't practice like that. Our providers take their time, they address our patient concerns, and, we value our patients. There's no Art of Dermatology without the patients and without what we can do with them.
Definitely. And like for other practices, it feels like you're just a number on a sheet.
Exactly.
Just trying to hit like a quota.
Mm-hmm. And that's not how we want to make our patients feel, or that's not the kind of care that we want to provide for the community.
For sure. So for services that you guys provide, I saw that there's like a bunch of different kinds, and starting off with like medical, what are some of like the main ones that you'd say you guys provide?
That's our bread and butter, right? And that's another thing that distinguishes us is we are still predominantly a medical practice that also specializes in other parts of the skin, but predominantly our goal is to take care of the medical aspects of what a patient needs. So whether it's rosacea, eczema, acne in teenagers, removing your cyst, removing your wart, but then more importantly, a large chunk of the population now is realizing melanoma is a very, very big problem. And we are encouraging patients, we encourage our patients, future patients, they should be coming in for annual skin checks and getting, that spot that's been growing, that spot that, that newly developed in the last 6 months, coming in and getting that checked by us.
And a lot of the times patients and people just see a spot on their body and that just appeared out of nowhere, or a mole, and they think that's normal, but that's actually not normal. And, it's so important that you get that checked out so you can prevent any further issues and, skin cancer, and then it starts getting all over your body and then it's just too late.
When does a medical or surgical procedure turn into like a cosmetic procedure? Like say you remove some sort of mole or something like that, and then they end up with a scar and they want to get rid of that. Does that become a cosmetic procedure?
That could become a cosmetic procedure. Or a lot of the times when patients come in and they see that we do provide cosmetic treatments, for them, that's like a convenient thing. Like we like to be a one-stop shop for everyone. Like you get your skin exams here, You can get, your facials done here. And it's like a medical practice. It's not just med spa. Nowadays, there's so many med spas everywhere. This is owned by medical providers and they specialize in skin. So patients, feel comfortable asking like, oh, like I'm insecure about this, or I want to change this on my face. Like, what do you suggest? And that's when the provider will suggest on what to do. And that's when cosmetics get involved. We have estheticians, they're medical estheticians that have over 10 plus years of experience, and they specialize in lasers, hydrofacials, chemical peels, and these are all medical grade services. They're not just fluff, or they're not, something where you can just relax and like you see a difference in these services. So that's when the cosmetic comes into a play.
No, that's huge. I mean, like, it seems like you guys know the behind the scenes as well, where like other companies just kind of focus on, the cosmetic stuff and don't really focus on the after effects or what's causing some sort of issue.
Of course. And, we never like to make patients feel uncomfortable about the cosmetics. A lot of the times, people put it in your face so much. They'll be like, you should do this and you should do that. For us, we don't believe that's proper patient care. That comes with patient care. Like, we're not here to, sell and make money. No, we're here to treat people. And if someone,
we don't push cosmetics. Mm-hmm. And what we mean by that is there are medical practices, dermatology practices, med spas, right? That their whole goal is that you're walking in the door, they want to sell you 3 different services, 4 different skincare products. Our goal is you come in our office, we want you to be comfortable with whatever you're there to get seen for, rather. If you're coming in for acne, if you're coming in because you just did have a full body skin exam, you come back in for your follow-up, you start getting comfortable, you like our practice, you realize that we are not going to push things on you. And then now at that point, you have an interest in maybe getting a hydrofacial done, or you're interested in getting, Botox. And, we know right now that injectables, Botox, Dysport, Jeuveau, is a big thing going on. And at that point, you're comfortable. Then at that point, we'll schedule a consultation. You come in again. We'll be able to then walk through exactly, what you're looking to achieve. Mm-hmm. Make sure it's done in the manner that you want and not, something pushing it on you. And from there, we tailor the entire regimen towards not just what you're looking for, but also towards your budget, mm-hmm. and make sure that the results that you're getting are actually what, you signed up for. And in terms of the aesthetic services we offer, well, the big difference between us and other, let's say, med spas or medical practices, we try to offer, lasers or any other treatment that will actually provide results, right? Like, we want you to get an actual medical result or a cosmetic result from anything you're getting done with us. That result, that's what we pride ourselves on. If you're not seeing the results, then, we're offering the wrong thing. And then we'll stand behind our word. We stand behind our company that we will then, offer you something different or change the regimen. Our goal is we will tailor it. We will continue to personalize it to make sure you're getting the actual outcome that you're looking for.
And going back to like you saying other practices trying to push these products at you that don't really even solve their problem, it kind of goes back to that feeling like a number type thing and trying
correct.
to like people being a quota more so than an actual person. So I think that's just huge that it's more so tailored to the person instead of
right. We want
the
patients to keep coming back, right? We use this analogy a lot. You go to see the dentist, right? You go to the dentist, you get your teeth cleaned, but then, you need to take care of your teeth in between. You need to brush, you need to floss, you need to actually maintain your teeth health, I guess. Same thing with your skin. You come in, you're seeing your provider, you're seeing your esthetician with us. They're going to give you this regimen, to get your, monthly facial or come in to get microneedling done or to have a particular laser treatment. But then in between those treatments, they're going to send you home with products and other, minor things that you can be doing to make sure your skin health stays kind of at the very top that you want it to be. We're not here to see you once and then say, have a good day. We want you coming back. We want you to maintain that health. We want to see the improvement. We want to see the benefit that you were looking for. We want you to make sure you're getting it from us. And so our goal is to create a patient, create a customer for life, not just, for the next 6 months.
Yeah, I was going to ask that because like for the dentist would be like a great example is like, come in twice a year, get your teeth cleaned. And then obviously you're taking care of your teeth throughout that time. But like, how often should people generally come in? Like, obviously you said earlier, if you see them all come in immediately, that's not normal, but how what's a realistic timeline for people to be proactive?
So on the medical side, we do actually encourage anyone over the age of 50 that you should be coming in for an annual skin check. That should just be a baseline. You should be just coming in, getting your skin checked, getting your skin evaluated. But then back to what you're saying, if you do see some irregularity, if you see some abnormal mole, you should be coming in as well, right? Or an abnormal spot. Don't wait, especially if you never existed before. It came on a Monday and then a month later it's grown a little bit. Schedule an appointment. It's better to be safe than sorry. That's what we're here to do, to make sure, it gets looked at and go from there. So that's on the medical side. We want people coming in for an annual visit. I think that's just the right way, or it is the preferred way now, taking care of and preventing any potential long-term issues. From the aesthetic point of view, we try to tailor each visit.
Somebody is coming in for a hydrofacial and they express that they want to get rid of their spots, and we have a service that could do that, which is like a BBL laser. They would come in, the esthetician or the provider would recommend them a set of treatments. And based on that recommendation, they would come in once a month, or they can come in every 2 weeks. So when it comes to the cosmetics, it varies. With the medical, it's more every 2 to 3 weeks when they're coming in for a skin concern. Cosmetic is different because everyone is treated, or everyone has different concerns that they need to address, and so it's a little bit different.
We make it a very personalized regimen.
Mm-hmm.
Mm-hmm. For sure, that's huge. What's one huge point that people can take away for like preventative skincare, for like things that they can do on their own to reduce having any sort of skincare problem in their life?
I guess that's really skincare products. We offer only medical grade skincare products. When you go to Sephora or you go to Ulta, there's so many different kinds of skin products that you think are actually good for you, but it does the opposite. Like, it probably makes your skin worse, and it makes you want to buy that product more and more, which is what those companies do. But the lines that we offer, which is Skin Better Science and Elastin, those products, they can only be bought in a medical office or aesthetic medical office. So they're not offered at Sephora or Ulta. So those products can help you prevent future skin concerns when it comes to the cosmetic side of things. And when it comes to the medical side of things, sunscreen. Wearing sunscreen is 25A. That's what I always like to say.
Yeah, so the number one thing that we recommend outside of the various professional grade skincare is definitely, like Mary was saying, is sunscreen. Right. We recommend everybody, you don't think the sun is out, but the sun is out. Mm-hmm. People should be wearing sunscreen daily, right? Even if it's just a base layer, sunscreen should be worn. That is the number one thing.
Even if it's raining, like the UV still can get to your skin and, can cause issues in the future. Maybe not right then and there, but in the future.
It's accumulation over time.
It's all going to show. So wearing sunscreen is super important.
Yeah, wear sunscreen, then come and see us. And then we can tailor a regimen with medical grade products that actually work. We know they work. We don't carry anything, and we won't give you anything that doesn't work.
So with wearing sunscreen every day, I know up here in Michigan, we don't have like the highest sun index. People are very low on vitamin D. Mm-hmm. So would that kind of get in the way of that, or would it still get through?
That's the myth of it. Just because you're wearing sunscreen doesn't mean you're not going to get the vitamin D. You're trying to prevent the harmful UV ray, the UV aspect of the sun, from hitting your skin, right? And that's what sunscreen is preventing. But the vitamin D you're still getting. So you're getting your vitamin D by going out in the sun, right? That's, the sun's good for you, right? It's good for you to get vitamin D. It's good for you to have fresh air. And that's always been the case. But the actual UV rays in the sun, that's what's harmful to your skin. And so sunscreen at least prevents that. Right, or minimizes that, and especially if you're on the sun a lot, if you're a boater, if you're on the water quite a bit, if you work outside, if you're planning on going on a beach vacation, etc. That's when we always typically think wear sunscreen. But the reality is you should just be putting on every day, because it's that slow accumulation of UV, which is where you start to develop these cases of melanoma that most people then wonder, how did this happen? Well, it happened over 30 years of getting exposure to the sun and not having any protection.
For sure. So where are you guys located? I know you said you have multiple locations in Michigan and Florida as well. Where can people go?
So we are actually now the largest dermatology practice in the state of Michigan. We're predominantly like centered around Detroit, so the Metro Detroit area. We have locations on the east side, Clinton Township, St. Clair Shores. We actually just opened a location in Lenox, which is, it's a little north of Macomb on the way to Port Huron. But then as well, we are on the west side of town, all the way to Ann Arbor, and our newest location, we are in Howell now as well.
Awesome. So somebody's watched this today and they want to get in touch with you guys. Where do you recommend that they go?
They can go on our website, theartofderm.com, or they can give us a call and they can schedule an appointment either way, or they can find us on Instagram and Facebook.
Awesome. So we'll definitely include that in the show notes below. So anybody who's driving right now doesn't have to keep rewinding that part, and it'll just be right there easily for them to get at. As we're wrapping up, is there anything else that you guys would like to include?
We're excited to be in Howell, and we're excited to take care of the community, and we hope to see patients soon.
So thank you for joining me today. It was a lot of fun having you in the studio.
Thank you for having us.
And thank you for having us. We appreciate it.
And thank you for watching, and we'll catch you on the next one.